Thanks, Shruti. I think it's a very special day. And before I go into the announcement, I have dear friends here from United States. Dr. Frederic Moll, we've interacted over the years. As Shruti said, father of surgical robotic. I was grateful because I used the robot for heart surgery, literally created by him, and a dedicated scientist, a visionary, and phenomenal. It's so great to have you, Fred, here. Barry Cohen. Barry, again, is a longtime friend, and we've shared some wonderful times and some not so wonderful times in the journey of trying to create something different. And so very welcome. And Brian Nodell, absolutely a phenomenal engineer, has worked with us for almost 4 years now and created some technology that are so unique and different. And our great team. I tell you, none of this will be possible without the team, not just the engineers, but the entire SSi team and what I call SSi family. And gentlemen and ladies from the press and friends and people who have come from long distances. So really, really appreciate. I was just reflecting, about this Make in India initiative. If you look back several thousand years, Sudhir was a founding surgeon of the Indian surgical system. And so many of his techniques way back when nobody else knew what to do, he developed instruments. So he introduced actually surgical, and there's a big thick text called Sudhir Samhita. And it's amazing actually if anybody has ever chance. So he was literally considered father of surgery. So India over the years have contributed a lot towards medicine. And I think not only the Sudhir as a father, but contribution, introduction of yoga, that is now a common word, practice all over the world, Ayurveda, all kinds of various natural remedies and so on. And finally, we have undertaken the technology. And I think in life, we know technology makes it better and easier. And if used correctly, it is a wonderful, wonderful tool. So when we look at medicine and the robotic system, it is absolutely a phenomenal thing for patients. We can do very complex operations through tiny holes. They get to go home early, recover fast. And the only reason patients come to us as doctors to get better and so they can do the things they used to do before, except that we will, in the past, offer them surgeries that will be associated with long hospital stay, recoveries, complications, etc. So I think robotic technology is a wonderful technology, allowing surgeons to go way beyond even laparoscopic surgery. Certain things cannot be done. So I think where we were lacking, as Shruti pointed out about, although I operated back in 2002, when I look at the history 20 years later, we have only 140 or so robotic systems for a population of 1.4 billion. Hospitals, 70,000 in the country. So just imagine how little access is there. So after having left the United States, I really felt there's an absolute need. And so we got onto this journey. And it was tough, but we persisted. And you look at the homegrown team, that what we have created literally in a very short time with a shoestring budget and very dedicated group, work on the weekends, nights, whatever it takes. And Dr. Moll is sitting here. He's gone through earlier years, and hopefully he will share. It's not easy. It's a very complex development. Hardware, software, electronics, all must work together. And it takes time. But I'm so grateful. I think, the joint efforts, we finally achieved it. And as Vishwa said, we launched this earlier part of, about a few months ago. Clinical validation is occurring, and more, obviously, goal is to launch. And finally, the idea was, how do we take it to the next level? And raising money, trying to become global, because this is literally a universal need, just not for India alone. I mean, rest of the world. Today, I think the recent announcement of we are 8 billion people on Earth. Okay, and if you take the robotic penetration and dominance is by Da Vinci system, even then, almost close to 6.5 to 7 billion people globally do not have easy access. And the biggest issue always was cost. And even in the richest economy in United States, the penetration is 30-35%. So still you have a gap, and the gap was mainly because of the cost, the learning curve, various reimbursement systems in different countries, and so on. So the whole goal was really for us as SSi, not just for India, and this is why we say its mantra is made in India for the world. Of course, India will be always our first platform. It will remain the manufacturing and assembly and R&D hub for some time to come, but we will go global. And keeping that in mind, how do we get there? So Barry and I have known each other, and this is the news, I guess, that everybody wants to hear. And so Barry is the founding chairman of Avra Medical Robotics, and we did a stint together some years ago. We didn't succeed, but he persisted in his way, I persisted in my way, and then finally the two friends got together, saw an opportunity to find a common ground that we can literally take it to the next level. And the easiest way for SSi was to get to public platform. And remaining private company, a startup, medtech, is not easy to raise capital, to really create that aura that's needed. So with that, Avra Medical Robotics and SSi group companies through our holding companies have merged, and we are actually registered today on the United States Securities and Exchange Commission, which will be like SEC. Okay. And from here on, I think the joint efforts, you'll hear a lot. And vision is far-reaching. I think we absolutely believe that access must be there, and we must decentralize excellence. So with that, I'll pass it on. And Barry, on to you. Shruti, go ahead, please. Thank you.